Hi, everybody. Thank you for watching my poster presentation. My name is Shiming Wang. I'm ASCP certified MRT. I'm currently studying Clinical Laboratory Science program in Winston-Salem State University. My poster presentation is evaluation of anti-C1q antibody to be a better biomarker for SLE diagnosis and activity monitoring used alone or in panel. Abstract. Systemic lupus erythematosus, SLE, is an autoimmune disease with multi-organ manifestation. The pathogenesis is generally considered as various autoantibodies excess production in attacking self-nucleus antigens, which leads to the occurrence of clearance impairment. The antibodies detection as biomarkers for SLE patients had been challenged for decades as they had high false positive values in sensitivity and low specificity. This paper aims at the validation of anti-C1q antibody assay as a novel but more efficient diagnosis tool for SLE patients and a better follow-up markers in monitoring SLE activity, especially the patients with renal involvement. This paper also seeks to investigate the correlation between anti-C1q antibody and the other two promising SLE biomarkers, anti-nucleosome antibody and anti-dsDNA antibody. To formulate the proposal of setting up anti-C1q antibody, anti-nucleosome antibody, and anti-dsDNA antibody combined as a test panel to efficiently diagnose SLE disease and monitor SLE activity to have a higher sensitivity and specificity. Introduction. Systemic lupus erythematosus, commonly called lupus. The word lupus has the Latin word origin as wolf, named by physician Rogerius in 1200. Rogerius described one of the manifestations of SLE patients that their skin showed the distinguished butterfly molar rash, look like wolf bite. It is not just limited as the cutaneous facial rash symptom. SLE is a multi-organ involvement autoimmune disease. The pathogenesis of SLE is still unclear, but generally considered as the defective immune regulation, which caused by anti-nuclear antibodies complex clearance problems. The non-cleared complex leads to the apoptotic cells diagnostic deposits in circulation system that triggers the complement immune response. This one is anti-C1q antibody. How C1q come to apoptic cells, make that because the sensitivity is so high, so that the antibody complex, but this clearance has an issue. This picture shows the immunoresponse test with anti-dsDNA antibody biomarker. This one also is about how anti-C1q antibodies deposit clearance problem. The non-cleared, as an arguing topic, the pathogenesis of SLE has been always challenging the clinicians, which also influence the good diagnosis of SLE. The conventional markers, such as ANA, anti-SM-RNP, and anti-SM, are targeted to all autoimmune disorder. So they have a high sensitivity but low specificity. Hence, there are more concerns rising up about the effective biomarkers and testing methodologies to be used for more definite diagnosis of systemic lupus erythematosus in various manifestations. Now let's look at the autonucleosome antibody and anti-dsDNA antibody. The comparison between anti-nucleosome antibody and anti-dsDNA antibody as the promising biomarker for diagnosis SLE and monitoring SLE activity was studied by Segal et al. Lately. They chose 120 blood samples to test these two assays by enzyme-linked immunosolvent assay, ELISA. In this selected cohort, 40 candidates were selected SLE patients who were recruited by the criteria SLE greater or equal to 4 of the ACR criteria. The rest 80 candidates were selected as the control, which includes 40 of the systematic autoimmune disease, SAD, and 40 of healthy people. Their results can be summarized in the following chart. This chart tells that anti-nucleosome antibody has the sensitivity 47.5% compared to 37.5% the anti-dsDNA antibody assay. Also, the anti-DS antibody assay, that's this. Also, you can see the Segal et al. Concluded their study as anti-nucleosome antibody showing stronger positivity than anti-dsDNA antibody. Hence, can be a better biomarker in the diagnosis SLE and in monitoring SLE activities.